Hello everyone, my name is Maharlika Diarse and I am going to be doing oral medication administration skills video. Before we start, I have my Nightingale scrub top, Nightingale scrub bottom. My hair is tied up and pulled back. I have nothing on my nails and I have my Nightingale badge and I have gloves, water bottle, liquid medication, uh, medication tablets, medication cups, gauze, my patient Miss Smith, and let's start. I'm going to verify the provider's orders. So the provider ordered all of these medications at 1700, which is at 5 p.m. And the first medication is cephalexin, which is Keflex, and it is at 250 milligrams. Potassium chloride, which is also known as Kador, at 20 MEQ. Lansoprazole, Prevacid, at 30 mg. Diphenhydramine, which is also known as Benadryl, at 25 mg. Liquid acetaminophen, which is also known as Tylenol, 500 mg or at 15 ml. And I am going to verify the 6 rights: the right patient, right drug, right dose, right time, right route, and right documentation. If these medications were not calculated right, we would have to do dosage calculation, but at this time everything is calculated right and everything's good. So I am going to start now. I'm going to take all my supplies and go into the patient's room. Before we go into the patient's room, we're going to knock on the door, wash my hands, provide the privacy curtain, and then I will place this at a safe place, typically at like the computer that you can pull around, with the EHR, MAR, everything away from the patient. But typically next to me. And so let's just pretend it's there, which is right here. And I'm going to introduce myself. Hello, Mrs. Smith. My name is Maharlika. I'm going to be your nurse today. Can you please provide me her name and date of birth? I'm going to check her wristband, and then I'm also going to check on the EHR and the MAR. So everything I identified, everything looks correct, everything's good, everything is right. And then Miss Smith, do you have any allergies? No. Okay. And Miss Smith, I'm going to be giving you all your oral medications because the provider ordered it for you. And all right, let's begin. I'm going to wash my hands again. And then I am going to compare all of the medications and the names and the medication labels onto the MAR and the EHR. Everything looks good, everything's right. I already did. And Miss Smith, I'm going to just check your blood pressure. I checked her blood pressure, everything's right. Pulse, heart rate, respiration, blood pressure's amazing. And Miss Smith, I'm just going to discuss with you of each action of the drug that is ordered for you. So Keflex, which is cephalexin at 200 milligrams. This is a skin infection antibiotic that was ordered by your provider. And some side effects are diarrhea, vomiting, and headache. And some adverse effects are seizures, bleeding, and severe rash. Okay, and we will go to potassium chloride at 200 MEQ. This prevents low potassium levels in your body. It keeps your potassium levels at a healthy level. And some side effects are nausea, stomach pain, and gas. Some adverse effects are stomach bleeding, chest pain, and irregular heartbeats. The next one is lansoprazole. This is for your heartburn, and some side effects are nausea, diarrhea, stomach pain, and some adverse effects are severe diarrhea, chest pain, and faintness. And faintness. And the next drug is diphenhydramine, which is Benadryl. This is for your allergies. Some side effects are drowsiness, dizziness, and headache. And some adverse effects are delirium, psychosis, and some seizures. The last medication is liquid acetaminophen, which is Tylenol at 500 mg at 15 ml. Some side effects are vomiting, dark urine, and dizziness. And some adverse effects are difficulty breathing, chest pain. And if you are having any of these side effects or adverse effects, just please let us know, okay? And we will come right away. Do you have any questions about your provider's orders? You don't have any questions, okay? So let's begin. I'm going to wash my hands. And make sure that our patient, Ms. Smith, is sitting upright. She's at a 90-degree in her bed. Her upper left side rail is up, so is her upper right. So I'm going to just lower this for now, make sure that the bed is locked, everything's great. So I have access to give her oral medications. All right, Miss Smith, since you're in 90 degrees, are you comfortable? Okay, so now I'm going to wash my hands. I'm going to put on my gloves. They can go on, right? All right. My gloves are on. So now I am going to prepare the tablets. This one is a cephalexin. I'm going to put this into the medication cup. I'm going to throw this away. Let's pretend this is the place that I will be. This is potassium chloride. This is lansoprazole. And this is your Benadryl. These are 4 tablets in total. Ms. Smith, would you like some water first? I'm going to pretend this is open. It's open. All right, Ms. Smith, would you like some water first, or would you like the tablet? You want some water first? All right. Here you go, Mrs. Smith. All righty. Ms. Smith, would you like to hold your medication? At this time, she would want me to do it. I already pre-did the water bottle. And all right, Ms. Smith, here you go. Here are your 4 medications: Cephalix, potassium chloride, lansoprazole, diphenhydramine. And I'm just going to check again, just make sure on the EHR, MAR, everything's aligning correct, everything's right patient, everything 6 rights, everything is good. All right, Miss Smith, here we go. And she has taken it. Here you go, Miss Smith. Here's the water to flush it down. All right, Miss Smith. All right, Miss Smith, if you could please open your mouth for me. I just want to check that you swallowed everything. All right, everything went down smoothly. All right, perfect. So now we are going to do the liquid acetaminophen. When opening the liquid, make sure that the cap is this way so that the liquid medication doesn't spill all over the cap. So let's pretend it is closed again, and we're going to shake it. Just make sure that everything's shaking right, you know. So we are going to open it, lay it flat on the surface, and make sure that you are holding like the label, so then the liquid medication doesn't spill all over the label. So now we have our medication cup, and the provider's order is at 15 ml. So at eye level, let's pretend that this is my table, and we are going to make sure 15 ml. Perfect, 15 ml. And now we are going to get a gauze, wipe off the excess so it is clean for the next use, you know, so everything's clean. All right, so now we are going to close the medication. All right, let's just verify onto okay, just for the skills video, I just want to make sure that you guys know that this is 15 ml. 15 ml. I'm not sure if you guys can see that, but it is 15 ml. I did not leave the patient's side. Just pretend this is just for the skills video. All right, Ms. Smith, this is 15 ml, which is 500 milligrams. Alrighty, Ms. Smith, here we go. All right, Ms. Smith, she has taken the acetaminophen. All right, Ms. Smith, would you like to wash it down with some water? All right, Ms. Smith, here we go. All right, Ms. Smith, we are good. All right. Ms. Smith, are you at a comfortable position? You still want to sit up, right? Alrighty. So now I'm just going to make sure that the side rail is up, the bed is locked, everything is great. So now I am going to make sure that all of this is in the trash, in the proper trash bin that it is supposed to be in. Leave the water bottle if she would like. Ms. Smith, would you like the water bottle near you? All her belongings. The call light is here. I am going to take off my gloves. Put it in the trash bin as well. And then I am going to wash my hands. Undo the privacy curtain. And Ms. Smith, if you just need anything, just here is your call light, and if you have any side effects or adverse effects, just please let me know. Wash my hands again. I'm going to document my findings right away. And that is it. Thank you so much.